about 5 to 10% of cancers, including breast cancers, are due to these genes that we can identify with tests. About 60 to 70% of breast cancers are just what we consider sporadic. They just happen. Combinations of lifestyle, environment, bad luck, little genetic things we're still figuring out. So the vast majority of women who develop breast cancer don't have a family history, which is why it's so important that every woman start screening at age 40. So we recommend mammography yearly starting at age 40. Then there are women who have a family history, but they may not have one of these identifiable genes. There's probably something going on in the family that puts them at a higher risk, even again, if we can't catch it on a genetic test. So we have calculators where we can put in information about the family history, information about that individual patient to get a sense of where her risk is compared to average. And a lot of those women will be eligible for more intensive screening or more frequent screening, different screening modalities, that type of thing. For all of these cancer genes, no matter whether the cancer risk is male cancer or female cancer or sex doesn't matter. Men pass these genes on and, can certainly have these genes and be carriers of these genes just as much as women. So, certainly we pay attention to the men in the family, and we would recommend testing for men if we know that there's a gene in the family that can be passed on. But specifically with the BRCA2 gene, there is definitely an elevated male breast cancer risk. That risk is still overall lower than the risk for an average woman, but it's about a 7 to 8% lifetime risk. And so some men who have these genes are actually eligible for screening themselves.
There is a little bit of a misconception because the gene is called BRCA that it's specific to the breast, but in reality, it's one of those genes that repairs our DNA when it breaks, and it does that throughout the body. So different types of cancers that people can be at risk for with BRCA gene malfunctions include breast, ovarian, prostate, excuse me, and even pancreatic cancer. And we don't exactly understand why those specific cancers are increased in people with BRCA mistakes, but we do know that these genes cause an increased risk of cancer and not cause the cancer themselves, and that's part of why these genes can manifest differently in different people in the family.
First, I think it's a matter of determining how likely is it that the mom had a BRCA gene. Again, only 5 to 10% of breast cancers are due to those genes or some of the other breast cancer genes. So if mom is still alive and interested in getting genetic testing, that's the best place to start, because then we can get a better sense of why mom got breast cancer. If mom has one of those cancer genes, then the daughter has a 50% chance also, and we would definitely recommend testing. Unfortunately, sometimes the family members who had cancer have passed away, they're not here, or people don't have close relationships. In that case, we get more details about mom's breast cancer, how old she was, what type it was, to see if the daughter is eligible for testing. But even if she's not eligible for testing, the daughter, she's probably at a higher than average risk for breast cancer because she had a mom with breast cancer. So someone like her, might be eligible for additional screening beyond just yearly mammograms. This depends a little on the gene and what cancer you're talking about. Say there's a known BRCA gene in the family, typically we recommend that the women in the family be tested by age 25, because that's typically when we're going to start screening for women who carry a BRCA gene. We start yearly MRIs at 25 and then start yearly mammograms in addition at age 30. But some of the cancer genes and some folks who have non-gene related family histories of cancer, the age at which to start depends on that history. But certainly for mammograms, age 40 is when we recommend starting. And we actually recommend, and several professional societies now recommend, that anybody who is assigned female at birth have a risk assessment for breast cancer risk by age 30, specifically to try to identify the women who might be eligible for earlier onset screening or genetic testing, so we're not waiting too long.